been to one, the information that you can get from them is absolutely amazing. And then, of course, we have our friend, our supporter, Daniel. Thank you so much for being here. Owner and lead trainer from Push Fitness. So thank you guys for joining. I'm gonna let you guys take it away, give some introductions, and then get into the topic. And we'll just ask questions as we go.
Okay. In terms of beginning the process, first of all, I have to thank you guys for allowing us on here. One of the things that we love doing is being part of a learning process for El Paso. As part of a community-based group, we enjoy talking about subject matters that affect our population. Daniel and myself have been individuals that have worked on and have worked together probably well over, I'd say, about a good 15 years or so, probably longer than that. We focused on taking care of individuals from the beginning of maybe their issues physiologically, but we also deal with them on the emotional side of it. As an outsourcing of things, functional medicine is the combination and understanding of how to deal with chronic disorders. At its basis, inflammation becomes one of the most important subject matters at the root of all causes. So by the time you start practicing medicine, whether you're a cardiologist, whether you're a orthopedist, you deal with inflammation at your own area, such as in your joints, such as in the area of the lumen of arteries. Danny and us, we deal with patients on the physiological side of things, on the biomechanical side of things, but we by no means don't interact with inflammation at its basis. So we've learned a lot about inflammation, and what we understand today, it's probably one of the most central themes affecting immunology, cardiology, neurology. Every sort of ology you can find gets its basis through inflammation, to the point where there's actually a new outbranching of doctors called inflammologists, where basically we can determine how things interact with themselves. Now, when we look at certain areas, Danny and I, we work on each individual patient individually, and we focus on a functional medicine approach. A functional medicine approach is to look at things more from long-standing disorders and issues. So one of the important components is to understand the particular problems an individual has and work up a case individually. So as we do that, we realize that inflammation, whether it be at the arterial area or even in the brain or even at the gut, we have to understand that it does have its beginnings. So there's much to talk about. So I'm open for questions, and I can kind of take it in any direction you wish. Can you guys hear me?
Yeah, absolutely. I think that's a great foundation of understanding what inflammation is. I mean, especially, just as a beginner, like understanding the components, it can be pretty much in everything. I hear it revolving a lot around like gut health, but how specifically does it affect the heart?
Well, one of the things is that in, let's say, prior to, I'd say, the 2000s, we would always look at the lumen or the arteries or the arterioles at the smallest level. We really understood that at its basic, it would be clogged and there would be cholesterol plaques. And we learned that our goal was to prevent cholesterol. Cholesterol got a bad rap in the 70s, 80s, and 90s, beginning from the story of the egg on Time magazine, that cholesterol was a bad thing. Today, we've learned that cholesterol is a good thing. However, we have to how to mediate and manage the lipid profiles of individuals. So today, what we look at, and we understand that many interactions affect the artery at the molecular level and at the lining level. So we try to figure out what is it that affects the artery before the clotting or the issues of myocardial infarction occur. What we learned is that we can go back into and to find problems back into the diet. So what we've learned also is that it's not so much of a fat issue, it's an inflammation issue. Typically, what we've learned is that a lot of times you would say back in the day, fats are bad. However, today we've learned that fats are good fats. So we understand that carbohydrates are at the root of much inflammation. So what we have to do is we have to understand that are things that cause arterial issues, such as inflammatory states, oxidative states, lipid profile states. The level of the blood markers that we evaluate, such as triglycerides, lipids, HDLs, LDLs, high blood pressure, those all factor into. But one of the things that we have to do is we have to consider, as you had mentioned early, mind things like emotional things, relaxing things, transcendental meditation. That's one of the things that we want to bring into the fact that we can help people and decrease stress and decrease the effects on arterioles by many things that we can do from our diet. Now, you mentioned something about gut. Gut has a lot to do with what we eat and also our microflora. So today we understand that if we deal with the issue of understanding the biome or the microbiome in our bodies, well, we can also understand the issues that are affecting inflammatory states and create an inflammatory oxidative load on the body. So we understand from complex ways that the gut directly implicates the coronary arteries. The diet affects the coronary arteries. The stress level affects the coronary arteries. So we look at a bunch of different components and we come up with the realization that we've learned a lot. Today, we can actually see inflammatory states even at the genomic level. So one of the new advents of medicine is that we can really see into human genomes and understand if a person has certain gene predispositions and adapt to their diet and make their diet recommendations based on the genetic profile. Now, we don't want to make a dogmatic opinion or a point saying that you have this gene, so you're going to have heart issues. It's just susceptibility. So those are the areas that we look at now from a functional medicine point of view, not only genetics. We look at environmental life choices. We look at their particular vascular dysfunction. We assess it. We look at their anthropometric measurements, which are body fat composition ideals. And we can make some decisions based on what's going on. Working with the cardiologist helps us also build the better treatment plans or care plans for patients in the treatment protocol, if that makes sense.
Absolutely. So I think like inflammation, a good way to kind of explain it is a lot like stress. Like your body reacts to inflammation for certain things, and it's really good. Let's say like a bee sting. And when there's too much inflammation throughout your body, like that's when it's really bad. Just like stress. Stress is good for your body to do certain things. You know, you're being chased by an animal. But when stress is continuous, then that's when we have problems, right?
Yeah, right. So, like, if you notice, like in primitive times, most people all they had to worry about is being eaten by a tiger, and getting attacked by another tribe. But once that happened, they would let it go. Just the same way an animal, if there's a predator around, they get stressed for a minute, but then they go back to their homeostatic state, so they go back in balance. With us, when it comes, for example, like April 15th tax day, there's only so much you can do rationally and logically to reduce that stress, but it's not going to go away. So you have to find a way to let go of that, so you're not constantly in an unbalanced state. And the more we're not in an unbalanced state and away from homeostasis, then the more stressed we are. And if we don't figure out how to revert that, all of those free radicals will form in our body, causing more inflammation, causing more stress, causing us to feel older, look older, and at the same not have a clear mental understanding of how to approach life on a daily basis. Because you're always, even before you wake up, you're just like, I got to deal with this, I got to deal with that. Whereas opposed to if you find a way, like how Dr. Jimenez was saying, to find a meditative state on planning, hey, I'm going to wake up in the first 10 minutes, I'm not going to look at Instagram, social media, or anything like that. Instead, I'm going to put on something positively optimistic to enrich my mind and to regenerate that, because for the foremost, people will like, I got to get on this diet and I get it, and then before you know it, they're stressed about being stressed about being stressed. So then they're just adding more stress.
Yes.
So then it's a never-ending cycle. So finding a small balance, like very, 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 it's just a small different state of mind that you can do in the mornings or midday that allows you to reset your body will start helping with that inflammation. And of course, Dr. Jimenez said, going back into your gut flora, ensuring that you're processing, digesting correctly. And a lot of times, it's not that diets don't work. It's if you look at your digestive system, it's like you have clogged pipes. You got to call a plumber if your pipes are really bad, right? To get everything going again. Same concept with the digestive system is you have to find prebiotics, probiotics, things like that that will help re-regulate your digestive system so you can start metabolizing everything more readily and absorbing more nutrients at the same time.
Yeah, and just like anything, in order for us to really pay attention and want to change our habits and, try and reduce our inflammation, we need to be scared. So what are some common conditions or, what are risks that inflammation can lead to, like other than just like bad gut health or
Go ahead,
Well,
Doug.
anything
well,
like
at
that?
the basis, once we understand inflammation and understand the causes, stress is a risk factor. Lifestyle is a huge. We're learning today that the American Cardiac Association has determined that, and this is not something that does require common sense, but transcendental meditation is the only thing that actually lowers blood pressure. So meditation, finding a ability to help the patient understand that it lowers the blood pressure as a thing that you can do. Obviously, you can take medications. You can also change the food styles. So the stress levels that we have is a huge area. So that's the thing that we have come to understand that is a predisposing factor. You have genetic predisposition also. We have a new player in the whole world of hypertension. It's called metabolic syndrome. Metabolic syndrome is a cacophony of disorders such as high triglycerides, increased belly fat relative to the waist. Those are predisposing factors. You have high cholesterols, low HDLs. HDLs are considered the good fats, and we want to make sure we have those high. Those are the guys that pull the fat out of the artery and take it back to the liver for processing. The LDLs are the ones which you want low. Those are the guys that take the fat and put it into the arterial wall. So when we look at those things, those predisposing factors, we can assess that. We can monitor blood pressure. The issues go beyond, because the smart doctors in the room are always going to look towards the kidneys. The kidneys, when they're damaged as a result of high blood pressure or someone that has a kidney disorder, they're going to create implications or problems later on in the future. So it's very imperative that we get blood pressure under control at the earliest possible. The other things that we have to look at are even genetics, genetic predispositions, the types of medicines that we have, the cross use of many medications have, as a result, a side effect of increased blood pressure. Our dietary predispositions, such as too much salts, too many of the wrong carbohydrates, too many of the wrong sugars, actually increase the blood pressure as well. The other thing that is also going to affect the heart is also diabetic issues. So insulin resistance is a huge disorder that over time the body doesn't figure out what to do with the glucose, and it keeps on pumping out insulin. Insulin directly affects the arteries, directly affects the function of our organs, and leads to what we call visceral body fat. So the individuals that have a lot of visceral body fat, that's the fat that's wrapped around the organs such as the liver, the kidneys, and the gut. This stuff produces hormones, at which directly affects what we call the aldosterone, the angiotensin system, the nitrous oxide system, which actually controls arterial compression. So we need to understand what is wrong with the individual through a very a quick assessment, even a metabolic assessment, and we can figure out what we can do to help the individual get better and stronger, if that makes sense. I hope I give you some ideas as to where to begin.
Yeah. So do any of those, like, what is directly affected if you have inflammation? Like, why would we be scared to have inflammation issues?
Well, again, as we look at it, inflammation is the first marker. Now, what we do as clinicians, we use a basic level of what we call C-reactive protein. C-reactive protein tells us the overall state of inflammation in the body. That gives us an understanding of what the overall sense of inflammatory changes are happening in the body. But it's a kind of like a, how is the sound in the gymnasium? You can kind of sense, okay, there's a lot of screaming people, so we kind of know that it's a ruckus in there. So it doesn't really tell us specific. Today, we can actually assess inflammatory markers, and it does make a difference. So what it does cause, it causes disorders. Now, let's just take one area. For example, if our intestinal biome is off, what we start learning is that we start having fractures in the intestinal wall and what we call a disorder called leaky gut. The bacteria that actually builds in those particular regions are going to produce lipoprotein lipase, which is a bad thing from gram-negative bugs. That stuff causes an immune reaction that causes effect on the entire whole body in terms of autoimmunity is activated, could be activated in that sense. Also, we can activate even inflammatory results inside of the brain. So we can lead to issues such as central sensitization, which is a higher state of pain as a result. A lot of people, consider like fibromyalgia, for example. We end up affecting not only the mitochondria of the systems, but we also affect the neurological presentation as a result of a gut dysbiosis. So just taking one area, we are learning today about certain areas like dementia, Alzheimer's, Parkinson's. We are seeing that they all have inflammatory basis. Cardiac injury is as a result of inflammatory reactions that actually crack the arterial walls and cause a repair mechanism, which causes actually a reaction from what we call the complement system, which is the system that actually protects our platelets and actually activates our platelets, and we may have thrombosis as a result of it, or embolisms. So we do have a lot of things that cause inflammation, and it seems to span all the way. And we don't just have to have inflammation in terms of like a joint issue. It affects pretty much everything. So we now understand that we must keep inflammation at bay, if that helps.
Absolutely. And like Tony's asking here, is there a blood test for that C-reactor protein to see how much inflammation we have in our body?
Yes, one of the cool things that the Boston Heart Health has assessments can do, we can actually do advanced lipoprotein assessments, which take all the markers from all the way to heart damaging issues like troponin to C-reactive. We can also see the oxidative state of the body. So once we can look at someone, we look at ApoE, LPLL. There are different letters that indicate different types of fat markers. So we can actually assess those and really come up with a plan for the individual. Now, does it mean you're going to have an issue? No, it just means that the susceptibility, and statistically speaking, if you got a cholesterol of 300 and you got your HDLs at 20, you're not in the most optimal state. If you got a blood glucose level of 200, 300, we need to fix these issues, because ultimately we're going to have damage to the kidneys. So it's very important to also bring in exercise. Exercise is a huge component of this, because one of the things that we've learned is that exercise does better than even most cardiac medications. So at TOPS, you'll see the frustration many cardiologists, and this is maybe something outside my scope, but they say it commonly, and it's common knowledge that cardiac medication is a method to try to decrease blood pressure. However, exercise has an unbelievable ability to not only decrease inflammation, decrease oxidative states, and also be able to prevent even cardiac issues down the line in a way that most cardiac medications can't do. So we're in a world right now where exercise, understanding oxidative loads, oxidative states, also our biome in our intestine makes sense, and we start realizing that we have to have a relationship with our body. We have to understand that we have to relax. We're under an extreme amount of stress. Our adrenals are pumping out. The world's different, and creating a state of cortisol that creates inflammation in the body to the point where we are actually suffering from a great disorder called metabolic syndrome into these ages. So I hope, what I want to do is I want to make sure that the world understands that inflammation is one of the newest things that we have been able to tie through one system to the other, from the brain to the joints to the body to the biome of to the intestine, to the way the human functions. So we need to make sure we keep inflammation down. So to answer your question, there are tests to specifically assess inflammation. However, they have to be really, really monitored with the appropriate doctors in their particular field.
So it's not something they can go like to Quest when they're getting normal blood work and say, hey, sign me up for that blood test that shows how much inflammation I have. They
Well,
wouldn't be able to do that.
yeah, that's a good question because actually you're going to have to do an advanced lipid panel, or you can actually do things through Genova or Quest. Different companies such as Vibrant, you can actually do the Boston Heart assessments. And what they're doing is that once the doctor orders those a little bit more elaborate tests, they can really, really break down and drill down into your inflammatory markers along with your cardiac markers that actually make a difference. So it gives you a lot more tools than what we had 20 years ago.
Somebody's asking how often they
yeah,
should get the test done.
How often? Oh, if you have coronary, first of all, talk to a good cardiologist. That's what we need to see. Okay, we need to see that first of all you have to be in the right hands and someone who does this all the time. My type of practice is a general practice, and I can identify the issues, and I use cardiologists. But as to answer your question, how often? If you've got cardiac issues and cardiac markers, you're going to find doctors reassess you between 3 to 6 months, depending on the complications of the issue. If it's more and you have more complicating issues, much sooner and much more often.
All right. So it sounds like exercise is our way of, how Daniel put it, is calling our body's plumber, right? And then just kind of.
Yeah, and exercise does help. One of the biggest things is Dr. Jimenez was talking about the meditative state is if you go in any exercise program, you go in, sometimes we go in to let off steam, right? But if that steam's not let off during the end of the workout and you're still in an irritated and annoyed state, your homeostasis balance won't change. There was a study done that 2 separate groups, and they were actually a study of actors, so they can get into that emotional state. The 2 actors, the ones that went in an angered state, and the other ones that went into a peaceful state. The ones who were in a peaceful state did very little. Their homeostasis balance levels changed and stayed even. Whereas the angered people, they pushed harder, worked harder, but their homeostasis levels stayed the same, blood work stayed the same, and they're still just as bad as before they started. Reason being is that just how important, in other words, you have to let it go. You have to let things go. And if you keep holding on to things, it's like a giant pressure cooker. If you don't let out the steam or the pressure, it's going to blow up. And it's as simple as in layman's terms. So things are as good as you allow them to be inside of you, because it's not a one-size-fits-all type of deal, and everybody's looking for that quick fix. So with exercise has to come with a good nutrition plan, good eating, a good way to cleanse out your system. You have to drink water and things like that. And you got to start with something that's going to allow you to succeed. Because if many times, well, I want a strict diet and I want this, and you're going to set them up for failure before they even start. So you got to set them up in a way that not to put them in a more stressful situation, but something that's going to allow them to live a functional and better lifestyle, so that they can still go to work, still have fun with their kids, but not to the point where like you work them out so hard and now exercise, they don't want to do anything when they get home, and before you know it, it's going doing the adverse effect than helping the body in itself.
Right. Some people don't realize how much stress how much it affects weight gain or negative weight gain. Like they might know it does, but not how badly it directly correlates to weight gain. Just stress alone.
If I may, one of the things is in today's society, we deal with a lot of stress from the moment we wake up. With this new COVID dynamics, we've been under an enormous amount of load, whether financially, emotionally. Many dynamics are changed. So we're humans. We're mammals. We were meant to meet each other. We're meant to talk to each other. We're meant to communicate. This separation creates a lot of stress. Now, where is stress related, and where does stress affect us? Well, we've seen that the initial areas that it affects is our cortisol response. When we deal with cortisol response, we deal with issues that affect the blood sugar. Now, when a person's under constant trickle of stress, we're going to produce cortisol at certain levels. And you're going to be able to see that if someone's stressed out, they're usually bloated. Mm-hmm. They usually gain weight. So you don't have to ask them, are you worried? If you see your friend and they look like they're kind of swole, but in the bad way, their face is puffy, their bodies, they look more like an apple-shaped individual than when they were thin. They're under a lot of stress. Once the cortisol reaction starts occurring, it just starts putting the person into a constant state of fright and flight, so to speak. Excuse me. So what happens is that as that occurs, the insulin becomes less effective, so it doesn't absorb well. So then what